Assalamu alaikum, I am Aqsa. Welcome to my channel Nursing with Aqsa. Today we have to discuss about emergency drugs. Number 1, injection calcium gluconate 10% indication dose hypocalcemia, 10 to 20 cc, 30 mg/kd. Cardiac stimulation, hyperkalemia, magnesium sulfate overdose, osteoporosis and rickets. Route intravenous slowly. Number 2, injection dexamethasone indication, adrenocortical insufficiency, head injury to relieve cerebral edema. Route intravenous slowly. Dose 5 to 24 milligrams. Number 3, injection diazepam indication, relieve anxiety, tetanus, status epilepticus, muscle spasm. Route intramuscular, intravenous slowly. Dose 2 to 10 milligrams. Number 4, injection hydrocortisone indication, hypotensio N, anaphylactic shock, bronchial asthma, sunburn, soft tissue inflammation. Route intramuscular, intravenous slowly. Dose 100 to 300 milligrams. Number 5, injection vitamin K indication, to increase prothrombin in liver disease, vitamin deficiency. Route intravenous slowly. Dose 2.5 to 20 milligrams. Thanks for watching my video. PLZ, like, share and subscribe my channel and support me.